Hi, my name is Jensen, and today I'll be presenting the qualitative data that emanated from a 12-week physical activity trial. Acute and chronic exposure to negative cognitive, physical, and psychosocial challenges can hinder adolescent and young adult cancer survivors' ability to participate in normal, everyday activities like school, work, and hanging out with friends. This can lead to negative self-perceptions, which are a risk factor for decreases in several health outcomes. However, physical activity may represent an avenue for addressing these concerns. As a result, the study sought to explore adolescent and young adult cancer survivors' self-perceptions and the potential influence physical activity may have on their self-perceptions within and beyond the Exercise and Self-Esteem Model, also known as the EXSEM. The data I'm discussing today was part of a larger pilot feasibility trial conducted by my colleague Amanda Wers for her PhD. In this trial, participants were initially screened for eligibility and completed a consent form. At the baseline assessment, participants were asked to complete a questionnaire and a semi-structured interview. Afterwards, they were randomized to either the 12-week physical activity intervention or the 12-week waitlist control group. Those in the physical activity intervention received a 12-week individualized physical activity program comprised of 2 weekly resistance training sessions and 2 weekly aerobic training sessions. Those allocated to the waitlist control group were advised to continue as normal, and then they'd receive the intervention afterwards. Finally, participants are asked to complete questionnaires at week 6 and after the intervention, which at that time point, they're also asked to complete the second semi-structured interview. At the time of the first interview, the sample consisted of 16 adolescent and young adult cancer survivors who were on average 33 years of age and had been diagnosed with cancer an average of 2 years before they started the intervention. The pre-intervention interviews focused on their cancer experience, their physical activity behaviors, their self-efficacy for physical activity, their physical self-perceptions, their self-esteem, and quality of life. The post-intervention interviews built off of these previous topics and also explored changes they experienced over the course of the 12 weeks. The data that came from both semi-structured interviews was then inductively and deductively thematically analyzed. From the data, we had 5 main overarching themes emerge. Our first theme, the evolution of the self in the wake of cancer, emerged when participants reflected on who they were as a person. As you can see from Grace's quote, participants felt that their past experiences with cancer influenced their thoughts, feelings, and behaviors to the extent that many felt an expanded sense of self and a deeper connection to who they were. Our second theme captures participants' feelings of frustration, discontentment, and sometimes even a form of grief when they reflected on their past physical abilities in relation to their past selves or their peers. Our third theme builds from this previous theme. Although participants were not content with their new appearances, these feelings did not consume their thoughts, feelings, or behaviors towards themselves. Instead, participants also expressed feelings of tolerance or understanding towards these changes in their appearance because their bodies had survived cancer. Our fourth theme, confidence for physical activity is not universal, has 2 distinct sub-themes, as you can see reflected in Livia and Shelby's quotes. Participants expressed varying levels of confidence to initiate physical activity, which was intricately linked to their previous physical activity experiences. For participants who explicitly described positive perceptions of their past physical activity experiences, like Olivia, they held greater confidence to adopt or increase their physical activity. However, those who were more hesitant or unsure about their confidence to adopt physical activity, like Shelby, held more negative perceptions of their previous physical activity experiences. Finally, our fifth theme, a physical activity intervention promotes healthy self-perceptions, captures the changes in physical, social, and mental functioning that intervention participants expressed post-intervention. At the end of the intervention, participants felt they had more confidence to be physically active and placed greater emphasis on the importance of their strength and their abilities. Theoretically, the findings from this study suggest that the pathways presented within the EXSEM may not fully capture the experiences of adolescent and young adult cancer survivors. Despite participants describing poor physical fitness and varied levels of confidence for physical activity, they also described positive subjective evaluation of their self-worth and self-acceptance. Conceptually, there is a link between self-perceptions and psychological health outcomes. Including these variables in future trials may allow researchers to capture the complex issues facing survivors of adolescent and young adult cancer. Finally, the participants' self-reflections post-intervention highlight the importance of supporting adolescent and young adult cancer survivors to adopt or begin working towards higher levels of physical activity, because it can help them to shift the negative internal mindset they have towards their physical self to one that reflects that they are capable. If you have any questions, please feel free to send me an email. Thank you.